Hi, volume okay? Volume alright? Volume okay? Hi. Okay. Hi. So 称过水 doesn't work anymore. 称过水 doesn't work anymore. It worked last time. And I'm not wearing my headphone. So Jojo, if I missed something, there's a coffee or anything, please let me know because I cannot wear my headphone. It hurts too much. I go block bego. Aduh. Good evening. Long time no see. It's your fault. I'm always here. I'm always here. Okay. Okay. No G Black. I just came back, dude. It's my stream. I get to say the G word anytime. What I wrong? My phone fell. My phone fell, so I said the G word because my phone fell. Tentunya keluar. Iya. Kalau kaget. So I think a surgery is needed because I'm not getting better. I can't even wear my headphone. I can't even wear my headphone because it compressed against my ears. Let me get an anatomy of my ears, okay? Side face ear anatomy. Initially, we were gonna wait for 2 weeks, right? But the vibration that it has caused is now affecting my other ear. Is affecting my other ear. My head. Yeah, maybe because today I had to bring. Oh my goodness, Pyre Papa had the most insane earwax. I cannot believe that he's been wearing Q-tips all this time. Q-tip is cotton bud. For those who didn't know, he's been using Q-tips all this time, and then I forgot that I had a camera where you can use and look into. Wait, did I see Cliffo? Where you can look into. Yeah. Oh, and Blimey. Tell me if you're here. Oh, I have a few stuff. And it poured his wax in deeper. Hey, 9 million bicycles. Hey, yeah, yo, Cliffo, how are you? It's been a while. How are you? The background needs to go down. Let me know, okay? And it's full of earwax. It's so big. The earwax was so big. I wanted to sell it as a merch, as a Pyre Papa earwax, but I'm waiting for Brandon to come because he's the one into those kind of merch. And clocking and Brandon, you guys can start bidding. And Pawn is into that too. Okay, let me get this. Especially, it's been too long, but I'm doing alright. More concerned about you. Yeah, on September, I have to do another. I keep on saying X-ray, right? I have to do another X-ray for my. Used to make a candle. Rabbit is so big. Do you guys want to see Pyre Papa's earwax? It's so big. I'm making myself good. No, don't do that. I still have a phone pay. Don't do that. Porn only wants Mario's wax, I think. I've been telling him to stop using Q-tips, but he wouldn't listen. And then I shoved my camera inside his ear and it was massive. You could not even see his eardrum. Hey, oh my god, Pon is gray. Pon is gray. You can't even see his eardrums. I was like, that I was just watching these ENT cleaning, massive earwax, infected earwax, and then now I see this in your ear, and he was so cute. He was like a kid, and like, but I'm tired, but it's been alright, but it's he was so cute. He was like a kid, and I said, yeah, but just because someone is smoking for 30 years, it doesn't mean that they are healthy because they're smoking. That's what I said, because that's the analogy that Papa always say. It doesn't mean that you're when you're smoking for 40 years, doesn't mean that you're gonna be okay. Positive recovery. Thank you, Kirito. Arigato. Thank you. HUF, where are you from? Where is HUF? Hungary. Wow, thank you. And I managed to make him go to the doctor, and the doctor, the ENT, was savage. He was savage. I think he was trying to induce trauma to my dad, because I could see how painful it was, because this has always been a problem. I just found out that ear problems is it's hereditary. My grandpa has it. My dad has it. My 3-year-old niece had and maybe still has it once in a while. So I think it runs in the family. But I could see how much pain he was in, because I could feel it. Because the eardrums itself is whatever, but the nerves in your ear is crazy. It's crazy sensitive. So this guy, he was sucking, right? After sucking, he put in the little pin to take it out, and my dad was in so much pain. And I think, and then the doctor was like, it's almost there, it's almost there, it's almost there, it's almost there. Just wait a little. Like a pediatric ENT. It was like a pediatric ENT, because I could see how it was. So I could see how painful it was. I've been there. I could see. So yeah, but he got it out. Comorbidity with what? Comorbid sama apa? Yeah, so I think he was trying to teach my dad a lesson. I suppose that's how I see it, because he didn't even use the liquid. He didn't even use any liquid or anything to solidify, to take it and make it softer. He didn't do that. He went all in. It's like, you can do it. Yeah, I could see, because him and I, my dad and I, we are the same person. Basically, we are the same person. He's in pain, I'm in pain. We share the same illness. We share almost the same illness, okay? Anyway. So, blimey if you're here. Yesterday, maybe today it hurts more because I took my dad to the hospital, maybe. Yeah, maybe. But that hurt. I could see. I was gonna cry when I saw that, because I was gonna cry when I saw that. Yeah. Good luck on recovery. If I don't recover in less than 1 week, then I have to get a surgery. And what happens is that, okay, you stay. So one day I suddenly have this really loud abnormal tinnitus. It was really bad. I was just on one ear. I have tinnitus on 2 ears. So now my dad only has 1 ear. That's so unfair. Dad, I thought we share the same illness, but yeah. There is surgery again. So now what hurts is the somewhere around the ear. Hold on. I can't show through here, but okay. Okay, put your hand on your ear, in your earlobe, put it, and then push it toward your face, just a little bit. You know, there's a lump, right? There's a lump. On the lump, stop. After the lump, stop. That's where it hurts. And then goes up a bit around the... When you go up a bit, there's a skeletal dip there. That part is hurt. So that, and then you go down again. And then right on your jaw. So right under your ear and behind your ear. Repeat it again, okay. Okay. Put your finger on your earlobe. And then you move it toward your face. There's a small bone, right? A small bone. Stop right in front of the lobe. That part is very painful. And then you go up a bit. There's a slope to it. It's a slope. Ada kayak yung jatuh gitu ke bawah kan. It's a slope. That part also hurts. And then let's go back to the first point. You go down a bit, right under your ear leaf, which is around the joints where your wisdom teeth should be at. That part hurts. And then you go back to behind the ears. So you go up. There's another muscle from there's another muscle that has a bumpy muscle right after the no, this is bones, right? Right after that bumpy bone, that part hurts. Yeah. So after that part hurts, it goes down to your shoulders because your shoulder is so tense. It's trying to lift the pain. Yeah. So today I don't have my earphone on. I don't have my earphone on because my head can't handle it. It hurts too much. Yeah. It hurts too much if I put my earphone. The compression is too much. And yeah. At first, when I went to the ENT, it was, yeah, I got Avamis, which is corticosteroid, and then I got Otrivin. I have that already. Antihistamine and beta blocker. Yeah, and beta blocker. Hi, welcome. And nothing worked. My tinnitus got louder on the left ear. And then I have what is it? Tymphonography? Oh yeah. And then I went to excuse me, I went to an otologist. I don't want to talk about her. And then a neurologist, and he said I have Meniere symptom, which is a death sentence basically. Tympanometry, yeah. My tympanometry shows that the left one has fluid in it. So neurology told me, oh, you have Meniere disease syndrome. Because the tinnitus is so loud, I started throwing up because it hurts. And then I'm like, I don't believe this doctor. I don't believe this doctor. No? And I told him, doctor, okay, this is a heavy topic, yeah? Doctor, if I have to live with this, I will not be here. I can't. And the doctor dismissed it like, you can. He said this to me, I don't believe in medicine. But I believe the human body can restore itself, but medicine can make it faster. I'm like, yeah. And he said, and then I said, doctor, this is too loud. And he said, have you tried white noise? And I was so mad. I went, doctor, I had CBT, I've done DBT, I've done radical acceptance, I've done CBT, DBT, radical acceptance, and one more is mindfulness. I have 4 terms that I don't think he even understands. I bet he only knows CBT, and I can do that in my head. And he kept on saying, maybe listen to your own breath. I'm like, doctor, I like, in my mind I was like, oh my god, I didn't know that you can use a white noise, or try to listen to something else. And it told me to relax. Wow, I didn't know that I have to relax. I didn't even know. The point of this is to relax and to think of other things. Why did I not think of that before? I should have just relaxed and put on music or put on something else. I should have done that. Wow, I didn't think of that. So, but I told doctor, I can't do this. Sudoku is near. I can't do this. I can't. That's what I told him. He's like, no, you can. And I felt, I went home so crushed. Because it didn't feel like that. Yeah, stupid doctor. Yeah, no, it didn't make me out of stress. If it was a mania disease, I would be fine. I would rather have the name. Than not knowing what it is. Yeah. Hold on. Oh. Picture time. What is this? Water blue. But the thing is, I knew it was not mania disease. I knew it wasn't that. So I went for a face acupressure. I'm like, yep. Doctor stupid lah. I go traditional Chinese medicine now ah. What you want your kids to be doctor, but you don't believe in medicine lah. So doctor stupid lah. So I gave up. I went for face acupressure. Basically, they massage your face. Yeah, sinus, nasal, everything. I went home. I threw up mucus. And I was like, see, I was not lying. There was something wrong with me. Crazy, this doctor is like, oh yeah, you got mania disease. Like, I don't have mania disease, so now it doesn't make sense. I started googling it. Yeah, it causes vertigo, but it seems like the intensity of the tinnitus isn't like mine, because I've had it all my life on both ears. 2 frequencies on left, and now I have 2 frequencies on right. And I started throwing up mucus. So jadi katanya dapat ada mania disease kan. And then Zoey kayak udah fed up banget lah. Terus kayak oke lah, kita ke Shinsei aja lah. Terus aku totok wajah. So wajah terus malam-malam tuh Zoey muntah-muntah. Phlegm, ingus, muntah-muntah ingus. Nggak tahu berapa lama. Sorry, I translated it in Indonesian. Yeah. Hey, Brandon, do you want Pyre Papa earwax merch? Yeah. I showed him the time. Wait, where was it? Time panometry. Panometry. Show him time panometry. And then I said to myself, man looks like suffering. I mean, I'm about to get in another surgery. It is suffering. And then I wanted to meet this doctor on the 25th. Knockoff merch. No, it's a really big earwax by Pyre Papa. You rewind on the very beginning later, Brandon. It's a funny story. I've been wanting to meet this professor. He studied in the US. He studied he took his specialty in the US. Yeah. Picto growing on my skin, doctor, but medicine, I felt the pain in middle school. I forgot fungi inside your ear. Use spray. Doctor can use spray. She didn't get it. I understand. But my dad is also part of me, you know. Yeah. I'm not using my headset, so if there's anything that I missed, please let me know, Dodo. Where was I? Oh yeah, I started puking mucus. I was like, I'm going TCM, traditional Chinese medicine. We go to Shinsei lah. We go to Shinsei. The stupid doctor not telling me stuff lah. Yeah, it's giving me medicine for what? For vertigo lah. It got worse, and that's why you go to doctor. Don't use spray. I started puking mucus. I thought I was gonna do better. And yeah, the next day it went back. Does the medicine taste in your mouth? What medicine? The doctor just gave me a beta blocker, which is a vertigo medicine. And I've been wanting to meet this doctor who studied in the US. He got his specialty in the US. And when I went in, he opened my nose. And then he's like, allergy. Hi, welcome. I didn't tell him much. I didn't even have to tell him my history. He looked into my ears. Into my nose. And then it's like, allergy. I love this guy. This guy is so nice. This guy is so nice. I think he should learn TCM. Bye bye. This doctor so nice. I'm gonna ask what his Chinese surname is. Next time I meet him, I'm gonna ask him. I think he's Chinese, I think. Yeah. And then I asked him. Oh, and then he told me that because of this very prolonged and acute allergy, many parts of my nasal airway are swollen. And then he asked me to do an audiometry. Was it tonal audiometry? Just to double check what's happening with my left right ear, and it was also consistent. Audiometry. They put you in a room and they play different decibels, and every time you hear it, you have to press it. I don't know who the mermaid is. Traditional medicine, herbal, or therapy. Traditional Chinese medicine. This is not just medicine or herbal. TCM is something else. Because I'm guessing you're Indonesian, right? TCM is something else. Acupuncture is part of TCM. Traditional Chinese medicine. And he explained it so well. And I asked him, Doctor, I got stuff like hyperacusis. It hurts so much when I hear certain sound. especially after the surgery. It was 4 weeks of total disaster, but now I hear it still. And then he explained to me that there's the smallest bone in our body. Okay, clock, let me know if I'm wrong. Is in our ear. Are in our ears. And because that bone is very stubborn, it can't protect the eardrums from voices outside. So because it couldn't protect it, some of them go straight in and it hurts you physically. Good night, good night. It hurts you physically because it goes straight. That's how he explained it to me. Honestly, I am fine with any disease. I'm fine. I just need a name for it, because once I know the name, I know how to move on. Yeah. With mania disease, I was also ready to move on, but I can't do one doctor thing. I always have second or third opinion. And this goes with my mental health. Especially mental health, I always have second opinion or even more. But this one, mania disease, is something lethal. It's hear loss. You can't reverse it. You can't reverse it. Even speaking hurts. Get in my balls! Oh, thank you, Zen. Sending lots of love to it. You're lovely, happy. You're more capable, dog. Thank you. Thank you. Yeah, it's not curable. I don't know where he got that idea from, but okay. I tried to move on by getting acupressure, TCM, because doctor was Can you imagine being me? I was very Sudoku ball. I told the doctor, I begged the doctor, please, I can't do this. I begged the doctor. And he said, just rest. You can do it. Just rest. Your body is capable of taking care, of healing yourself. Can you imagine being me? I was begging him, please. Hang in there. Barely. Please, doctor, I can't. 2 more days of this, I will not be here. That's what I told him. And he dismissed it. He dismissed it right away. He's like, you can do what you can do. I hate it so much. I felt so lonely. And mania disease is it's a hearing loss. I'm a singer. Can you imagine? A musician. First thyroid and the hearing loss. But I wasn't gonna stay there, so I went to the other doctor, who confirmed it was not a hearing loss. He did an audiometry and I cannot remember these. Tympanometry, thank you. Audiometry and tympanometry. They did that and confirmed the left ear has a fluid inside. Audiometry. It has fluid inside. So there's your eardrums, and behind that you have your inner ear. And there is, let me show you. Let me show you. I heard many divers had to give up diving because of this. I feel so bad. Okay. I yeah, okay. Yustashi. Sounds like pistachio. Yustashi. Sounds nothing like pistachio, but I'm going insane. It's fine. Okay, here you go. Alright, so you have your. Is this your Eustachi? Eustachian tube. Okay, let me just go. Eustachian tube. It's a small canal that connects your middle ear. Middle ear meaning is something behind your what disease? I don't have many disease. Yeah, right behind your eardrums. A small canal that connects your middle ear to the back of your nose and upper throat. Okay? Middle ear, belakang gendang telinga. Middle is inside, right behind your eardrums, and connects to the back of your nose and upper throat. Okay? You got the idea, yeah? You got the idea, yeah? Now, when somebody has a flu, or if there's a build up to it, which naturally it does, it can drain it. It can drain it by opening, you know. The tube can open, right, cock? The tube can open, and then the mucus will go out. The mucus will go out. The thing is, I've always had ETD, eustachian tube disorder. I've always had it since I was a kid. How did I know? Because now I realized that since I was a kid, if I tilt to the left, I could hear. If I tilt to the right, I could hear. On some days, I can hear that. It's like a drain for the ears. So your snot should not be in your ear. They should go out of your ear, down to your throat or through your nose. Those mucus, phlegm, those fluids should not be in your ears. And since I was little, I could not dive too far down because it hurts. And every time I flew and had a bit of allergy, like nose blocked, or let's say I cry, I can't pop my ears open. Swimming with earplug? I've never swam with earplug before. And I didn't know. Turns out all these years, that's what I have. And yeah. So what causes all of these? Rhinitis. What causes all of this? Rhinitis. I went to the ENT. Oh, he was an otologist, by the way. He was an otologist. I thought he was just an ENT. He was an otologist. It was so nice. He even looked at my MRI, because I told him I have MRI. Look at my MRI, because he was treating my dad, but we were bonding. We were bonding, you know. he was cute, you know. This old man, right? When I got there, the doctor was on the nurse station and getting his blood pressure checked. That was so cute. I think he's in maybe 50s or something. That was so cute. Like, and he said, "Oh yeah, doctors also need to be checked." That's what he said. That was the cutest ever. And then yeah, my dad got blah blah blah. And then you know, he said, yeah. And then he asked me, okay, so when something happens to your ear like this, like ETD, is the cause in your ear or is it somewhere else? I was like, haha, Duck, you're testing me. I already know the answer. I said rhinitis. I answered so with a lot of pride. I'm like, rhinitis. And yeah, so I need to get my immune system up. And I need to stay away from my allergen as much as I can. So you know how I used to put laundries in a like laundromat, you know, so where somebody does it for me because it's much cheaper and much faster than doing my own. But now I'm doing my own because I think that causes some of the allergy too. And then I have 2 air purifiers now, one in my room, one in the living room. Yeah. So now I'm on. I have Reno's SR, which my friend said that they could sleep so nice with Reno's SR, and I'm like, I want to sleep. It's not making me sleep. Okay, the something I want to tell you, especially Blimey, since Blimey is a psychiatrist. Are you still here, Blimey? And all of you, is that every day I take benzo. A lot of benzos are muscle relaxant, right? Let me see. Okay. I go chat GPT because I cannot explain what is benzo. I cannot explain it in a systematical way. Benzos are a class prescription medication that acts as a central nervous system depressant. They slow down brain activity, producing calm, sedative, and muscle relaxant effect. I have benzos. I have a few benzos. And instead of tramadol, which is an opioid, controlled and prescribed, YouTube. Controlled and prescribed. It works better. When I took diazepam, I only take it at night. But when I take Cymbalta during the day, and then I take alprazolam, it works much better than opioid. Controlled, YouTube, controlled. Okay. So I don't have good experience with opioid because it doesn't do anything to me. You know, it doesn't do anything. It's like when you have a headache, you take Panadol, but it's so throbbing. So it doesn't do much, you know. I take benzos, and those works better than. What happened? Yeah. But today, and Chenggu Shui. Let me show you. Oh my gosh. I think I'm having heartburn. I've been taking my GERD meds like crazy. I use Chenggu Shui. TCM baby, traditional Chinese medicine baby. I love TCM so much. I can't save the picture. The allergen had been identified. Oh, I have a lot of allergies. I have more allergies than not. You should ask one I'm not allergic to. That's easier. But the doctor was so good. He was like, okay, the professor doctor that I went to. He was like, you're allergic to dust, are you? And I was like, yeah. And then he said, you have GERD, right? Yeah. And then there was one other thing that he said. Yeah, good, yeah, and then something I forgot. I forgot. I haven't tried TCM, but sounds like Peipakwa. That's TCM. That's traditional Chinese medicine. Peipakwa. This is amazing. I use this because it hurts so much. I use this on my back, it's better than Salon Pass. I've been using this on my, so I close my earlobe and close my eyes and my anything that's gonna get sprayed, and then I just spray that part, and then I started putting it on the back of my ear and everything. I haven't seen a better paper in my life. That's terrible. You need to go get that. I've been doing this and it's not working. But I do get some of my from nose is not really big mucus, yeah. It's just small driplets of fluid, but not enough to drain it. If I do that often, I will bleed. Do you get what I mean? And since it's not getting better, unless it's getting better in 2 days, then then maybe I start a surgery fundraising. Merch being produced in real time. Pressure from the blood vessel on your nose, yeah. But I use now I use corticosteroid, which should lessen the inflammation, and I have beta blocker, which should make the blood rush more into the ear, and hey, take care of the ear, take care of the ear, right? Beta blocker, take care of the ear, go. And then wait, I need to take on my omeprazole. Hold on. Right. I'm back, sorry. Oh, that hurts. I hate Oh my god. It's fine. Oh, and I went to the ER. I went to the ER. Remember when I went to the ER? Because I couldn't breathe. My blood pressure was fine. My BPM was fine. My oxygen was excellent. But I was so out of breath. I didn't know what I was doing. And I think the doctor thinks that, I'm having a panic attack or I'm having something. And I'm like, man, I told her, believe me, if it's something psychological, I would be so happy. I would be so happy because I would know what to do. But the moment it gets by, it's anything that was not neurotransmitter related, I have no clue. But, should it be something that my psychiatric meds can take care of, I am happy. I'm happy. But yeah, I didn't know what to do, and she gave me a vertigo meds, which which worked a tiny bit, just a tiny bit, but yeah, it was torturous. And then I knew there was something wrong with me, and I'm not the kind of person who can go into placebo effect. I'm not the kind of person. If you gave me a placebo, most probably, unless I'm insane, I wouldn't fall for it, because I know myself. Right now, if you ask me about my thyroid, I cannot answer, because it's masked by my problem. So if you're asking me about my thyroid issue, I can't answer that. You get what I mean? I have to peel it layer by layer, and I can't just take a placebo and then done. Yeah. This also happened to me when I first got medicated. My doctor didn't give me a full Xanax. She gave me Xanax with this and that, and it didn't work on me. I was thinking that I was going crazy, because shouldn't Xanax work on you? But yeah, it was too little. She said, yeah, some patients, when they hold it, it makes them feel calm. I'm like, I'm taking it, it's not calming me down. So this stuff has happened where doctors think that it's something in my head, it's something in my head, and I know if it's in my head, it's easier. It's much easier, really. If it's in my head, it's much easier. I know what to do. I've been doing this. Then I got to ENT, right? Because I thought I had a lot of earwax. That's what I thought. The tinnitus, maybe it was caused by the earwax, or maybe there is an infection in my ear. I don't know. So I went to the ENT, and then he put what is that? The camera that's into my nose, and it was so blocked. It needs a surgery. It's so blocked. And then he showed me my and then he opened my mouth to nasal endoscopy. Yeah, but yeah, it was, and then to my mouth too. And then he showed me my ear, which are dull, meaning that it's that's what happens to the tinnitus. It's because it's something that it's dull, he said. So let's do a time I cannot say that. Timepography. Time pornography. I'm like, that's not a pornography. Time pornography. Time panometry. Why do you keep saying time pornography? Hi, welcome. Time panometry. Time panometry. I keep on saying time pornography. Time panometry. Yeah, I'll see you at time panometry. See, I see I'm saying time panometry. Okay. Yeah, and it showed negative pressure on both ears. Time pornography. Tympanometry. Tympanometry. That name is difficult. Let's call it Bob. Yeah, let's call it Bob. Let's call it Tim or Pan. Let's call it Pan. Tympanometry. Tympanometry. Yeah, let's get you that. And then yeah, I checked. Both are fine. Guys, hold on. Give me 1 second. I think I know where my meds is. Hold on.
Hey Matt, came all this way, had to explain, direct from Domingo.
Lolo. Earthway. Hello. Okay. No, I felt something on my feet, and yeah, it was my meds. It fell on my feet. Felt something on my feet. Thank you, Brandon. Thank you. Go with the moving. What's on my feet? Oh. My ears are clean. You okay, Zoe? No, I'm not. So, yeah, on Tuesday I should be meeting my doctor, and then most probably we will have a surgery, because I don't want it to wait for too long until it affects other things. Until, hey, if you guys want to help me, really, if you're here for me, you're always here for me, please go to my shorts, loop them 3 times at least, like and comment. That's all I'm asking. Yeah, I also want to stop feeling pain. That's all I'm asking. If you want to help me, go to my shorts, loop it 3 times. Thumbs up and comment, please. Yeah. It's an easy procedure, but I'm also I'm afraid, man, because they're gonna rupture my eardrum. Do you want to see what they do? You can show it on stream. See, they're gonna make a hole in my eardrum, and then they're gonna suck those suckers. They're gonna suck the fluid, and then they're gonna put a tube in it. Yeah. Unless you're the medical intervention in it. So I don't. It's I'm not wrong, right? If you leave something for too long and it's all, because it started with tinnitus, which was very compared to now. It is still prominent, but at the time it was the major cause of it, right? Right? It is still prominent, but but right now, you know, so study from tinnitus, I couldn't sleep, I couldn't rest, and then it goes to vertigo. I started throwing up because of tinnitus, and yeah, and then it goes to my right under my ear. Hold on, I have this. Hey, welcome. I'm so sad. If I'm sad in a stream, I will make a dedicated sad stream because I don't want to sound like a sad girl in every stream. Here, okay, here you go. The red spots are where it hurts. Because it started with tinnitus. And now, these parts hurt really bad. It's like if you have an ear infection, you would feel that. But I don't think I have any infection because I don't have a fever. I do feel cold right now, and I do feel cooler today. After I haven't felt this cold before for a bit, but now I feel cool. And yeah, these parts are starting to hurt. And now it's spreading to my right side of my head to the point that I can't even use a headphone. Right? So, isn't that a red flag? My medical viewers, isn't that a red flag? Isn't that the time when you put your foot down and say, okay, we can't leave this be because it's gonna make things worse if I leave it. Or am I wrong? Please correct me. Yeah, please correct me. Ow, 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 ow. Hey, Mets team! Where are you guys? I want to go to a chiropractor so bad and like but be safe and sorry. I mean, it's a surgery, so it's not easy. The thing is, you have a co-current TMJ disorder, so we cannot really ascertain if this is the cause of eustachian tube dysfunction or not. It didn't occur right away. It's after 2.5 weeks of the tinnitus and the ringing that I started having very painful sensation hearing some audios, especially when they're high pitch. So this happened after 2.5 weeks. Yeah. I can't say I have no idea. No problem. I've had tinnitus both ear and how does it feel? I have tinnitus since I was a baby too. But this is an intense tinnitus where you throw up from it. Normally I have two tones on my left one, high frequency and lower frequency on the right. Now I have two. I used to have only one. But the left one, the higher pitch is deafening that I start throwing up. It turns out that it's eustachian tube dysfunction, or called UTD. But it didn't all come in one day. One day the tinnitus is loud, and then I started throwing up a week later, and then the pain around my ear started coming, and then it goes to my jaw, the pain on my jaw, is start coming, you know, because if it's TMJ, it should be on both part, right? But my right jaw is only painful when my left jaw is too painful. Yeah, that one. Get oofed? What do you mean? So the right one the right one is triggered by the left one. Nah. The right one is only triggered by the left one. It mimics. But it doesn't go... The intensity doesn't go right away to 100. No. It doesn't go right away to 100. It's gradual. But it's been 3 weeks and I see myself gradually being even sicker. Yep, correct. But the thing is, I don't think it's TMJ this time. TMD maybe. But I'm sure this comes from the ear. Oh, yeah. And again, the right one will act up only if the left one becomes unbearable, which is a lot. If the left one becomes unbearable, it crawls to the right one. But to the right one, it crawls from the head. Or it crawls from the you know, the back on top of your neck, you know. Either that. Yeah. So I don't think this is caused by maybe TMD. But it's because of my ears for sure. The fact that I can't even use a headphone right now. Thank goodness I have an open headphone so I can still hear a little bit of the music. It tells. I can't wear a headphone, it tells. I tried wearing it just one. Just on the right one, it still hurts. Yeah, I have a theory for it for now. My theory is really my ear. It's really my ear, cause I'm careful. I know my TMJ gets worse if I use too much of my muscle on of that. Yeah, my left. Yeah. Kind of headset earphone use. No. When you have tinnitus, when you put headset, it becomes very loud. Right now, I actually have a clip earphone. I'll show you. This is. I put it on top though because near the earlobe is too much. It's too loud for me. But I mean, you know, am I making sense though? That because of an ear, it can trigger other things. Am I making sense? Or is it all in my head actually? This clip earphone. So I clip it on the top of my ear. People normally put it on their near their earlobe, but I put it on top. Does it make sense, Clock? If I leave this for another week, I don't know what else is gonna happen to my body. Because if your body's in a lot of pain, won't it trigger something else? No need the sound. I'm pretty sure the cause eardrum is pretty big. No, the thing, the eardrum is not working well. The eardrum is not working well. That causes the tinnitus. And because of eustachian tube dysfunction, you have fluid every now and then. So, while other people's eardrum move when you pop your nose, you pop your ear, my eardrums, they don't move at all. So it creates a negative pressure. The negative pressure means there is some sort of fluid behind it. It's not a normal eardrum. So you cannot use earphone or earplug. At the moment, I can't use earphone because it hurts my ears too much. Depends. You have an appointment next week to the doctor? Yeah. No, but I mean, let's say I don't meet the doctor next week. I meet him in 3 weeks, let's say. Won't other things gonna start happening? Yeah, no, I was saying, if I wait for another, like, 3 weeks, won't stuff start happening, like exorcism and stuff like that? Ow. Man, I am an old man. That cannot be. You have 2-week treatment. You should meet him. No, I know. But I'm asking if I don't meet him in 3 weeks. In 3 weeks, I decided not to meet him. In 3 weeks, let's say. Other stuff can happen, right? It all started from ear. And let's say I decided I don't want to go in 3 weeks. Other stuff's gonna happen, right? Like a chain reaction. If they're not in any treatment, then I suggest you go to ear. No, I'm speaking hypothetically speaking. I'm saying hypothetically speaking. I'm in a treatment. You understand? I'm in a treatment. And it should be 2 weeks, but 2 weeks is too much, so I'm meeting him next week. I was supposed to meet him the next 2 weeks. Okay. But I decided I'm in a treatment. I'm going to continue the treatment, and now I'm like, I'm going to just continue the treatment, and I'm not going to meet him for 3 weeks. And then it doesn't get better. I will feel there will be other things happening, no? That's what I meant. There will be complication. But I'm already quite certain that this is not normal. I'm supposed to meet him not next week, the week after. But I'm not gonna wait this time. I'm not gonna wait. Normally I wait, but this time I'm not gonna wait. I don't want any other complication because it's already hurting. It's already triggering my right ear with 2 tinnitus. I always had 1 tinnitus, but now my right ear has 2 tinnitus. They're not bothersome. Just sometimes when the left one gets too much, the right one will be triggered. But just a few seconds, not too long. So, yeah. Imagine this is if I stop with the neurologist who said this is a Meniere's disease. Okay. Then what? Then what happened to my left ear? What happened to the fluid? You wanna let it stay there? Hey, welcome, welcome. Yeah. 좋아, 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 좋아. 좋아. Yeah, I'm happy I got a second opinion, yeah. Woo, imagine all the... how many of you have... No, yeah. The ENT that I went today with my dad, I showed him the insides of my nose, and he's like, okay, you need a surgery for that. An RFA. I said, you never, yeah. Well, I don't know. I needed some surgeries. I don't want it. I don't want it. I need a few surgeries, but I will only do it if I don't need to stay in the hospital and it's covered by the insurance. This one is not covered by the insurance because I don't want to wait. That's why I don't want to wait. This one I don't want to wait. Although I'm curious, once if we decided to do the surgery, I'm curious if what sort of fluid do I have inside, Is it gonna be just thick mucus like a glue, or is it gonna be yellow, or is it gonna be... I wanna see it live. I think I'm just gonna be knocked out. But yeah, let's see live. As I've seen some of the... Am I allowed to just play YouTube video of the of the surgery? Am I allowed? It's so nice, you see. Okay. Oh, thank you. Thank you, Anonymous. Who are you? Who are you, Anonymous? Who are you? Thank you for the message. Well, yeah. I wish I want to ask him to, if he's able to record it. I want to ask him to record it, or if he's able to show me the kind of fluid that's trapped. I would like to know. I would like to see it. Yeah. Cooking Zoey mucus from all the sap of the maple tree. Yeah. Yeah, wishing you have a good health. I don't have a good health at all. I'm about to get under the knife again. I'm gonna get a surgery where they make a hole in my eardrums. However, I am a bit scared. I'm a bit scared of infection because I sleep with my dogs. Oh, P, thank you. Let's see, let's Google it. What is it called? It's called a start from Montgomery. That I remember Montgomery because of Sims. Montgomery. Murray got to me. How? Okay, Mary got me. Sleep with pet. It's generally not recommended to sleep closely with pet for at least of 24 to 48 hours. No, no. I'm gonna put stuff. I'm gonna put something. I'm gonna put something over it. So freaking. It's about this feels good. Hi Zoey. Sooner. Sorry I wasn't here sooner, but I wanted to hear about the updates and stuff. But I guess just by reading. I have ETD. I have a eustachian tube dysfunction, and it's been going pretty bad with after the flu. It's not lucky. Just wanted us to drop by. Wish you all the best. Thank you. If you want to wish me all the best, please play my shorts 3 times at least and hit the comment and like button. If you want to support me but don't know what to do, go to my shorts. And like, thumbs up, and comment. Loop it for 3 times at least. Yeah. Yeah, it's been really difficult. Finally found a good doctor, and I'm putting my foot down, and if it doesn't get better until next week, it doesn't get any better until next week, guys, I will ask the doctor what's the good. What should we do? What we should do after that? Okay. Let's see. How to prevent infection from what is it called? I really cannot remember the Myringotomy. It's very tangible. YouTube algo. I don't know what's going on with YouTube algo. How to prevent infection from myringotomy. Keep the ear clear and dry. Okay. My baby, she's not a baby anymore. My niece had it. One has fallen. How does it fall? One has fallen, and one is still in there, I think. Why are they all pediatric? Is it more common with kids? They're most of them like pediatric. Yeah, clean and dry. Dead bacteria from the hands. Use cloth to carefully wipe the outside of the ear. Keep water from entering the ear. Okay. Take medication. Monitor your recovery. Clear the ear. 뭐야 이게? With pets. I'm not afraid of with a surgery. The biggest fear for me is paying. The paying is my biggest fear of a surgery, and then infection. Management and treatment. YouTube. No joke, no healthcare. Yeah, healthcare is not cheap. Not cheap. And I'm not rich. Yeah, it's difficult. It's difficult. Yeah, commenting also helps. Thank you. Ugh, oh my god. Oh, yeah. Okay, I don't know what else to say. If you guys have any question, I will be happy to answer it. But if not, I'm gonna call it a day. I'm helping any way I can. Yeah, comment, like, and yeah. Amazing fear is one of the most effective way of making it less difficult free from yourself, but it's a little bit. It's not bad. I am afraid of paying. I'm afraid of the price. Okay, I don't know how much it's gonna. Ani-chan daisuki. What happened? Oh, thank you. Jisoo. Wait, I got coffee. Thank you. Oh, let me open. Well, can't get the prize, but he doesn't know no medical. Go BPJS lah. If you have the time, go BPJS. But I don't have time. I'm in too much pain. I haven't been able to catch your stream. Just want to say hi. You'll get through this. I have faith you will. Why do you have faith that I will? Health comp as always. Yep. And then but you know, there were times where I can't afford You are a fighter, my friend. Everybody on your side, we love you. Thank you. Oh my god, thank you for the aka. Jisoo, thank you. From coffee I get 100% or like 99%. Thank you, Jisoo, for the aka. Jisoo, fight with me, okay? Fight with me. I can't do this alone. Fight with me, Jisoo. Thank you for the aka. Thank you. Jisoo, right? I'm saying it right. I don't know. When they created by trees, is your Zoe? Where with you? Well, because I'm Zoe. You don't know how many times I wanted to say that this is it. You don't know how many times people are keeping on a watch on me. So it's not because of I'm Zoe. I can't always go through things. I don't want to go through things. I don't want to be strong. I don't want to be strong. It's tiring. And it's lonely. Faith and hope are the last thing you should get rid of. Being realistic doesn't mean you have not having hope. I don't have hope for anything. Except for, I just hope for this pain to stop. That's all. Yeah. I don't know. Yeah, I lost hope many times. If you were in my position, you had cancer, you might not have your voice because the surgery might go wrong and one of the nerves gonna be accidentally cut or have to be. Your vocal box is I don't know, something happened to your vocal box. That alone is already scary. And then you soak in with cancer, and after that pathologist said there's some tumor left in your blood vessel, so we have to keep an eye on it. So in September I have to get an x-ray, and yeah, another MRI most probably, another biopsy most probably. So I do lose hope. I do lose hope. And now with this ear problem, I do lose hope. I just don't tell you when I do. But I do lose hope. And I want to lose hope. I want to lose hope. Crossbilly will be here in all your capabilities. Thank you. Loot my shorts. Loot my shorts. Give comments. So unless I will say that I can do it if you can survive 2 hours, not even 1 day. 2 hours.
Hey, Matt.
Of the
Came all this
tinnitus
way. Had to explain.
playing
Did from
in
the
the background.
Minga.
Oh, F. I'm a new viewer. 진짜? I'm a new viewer and I mostly look, but you are very entertaining. Who are you? Who are you? Come on stream. Thank you for the aka. Look man, my mids bill is 2 bars. Who are you, F? Come on stream. Oh, my jaws hurt so much. I lurk. Remarkatron. Was it you? Remarkatron? I understand. I do feel that way sometimes, even though I don't go through the same stuff. Something I can't imagine how it is right now. Yo, Felix, hi! Thank you for the sneaky. Yeah. Remarkatron. How do I call you? Thank you. You find me entertaining? I am. Okay, so I don't become an emo girl. I don't become a real levinge in you know, in every stream. I don't become an emo girl in every stream. But today is my sad stream. And if I write, you know, I make a dedicated sad stream. I'm not always sad and moping around in every stream. And I am quite surprised that you do find this entertaining. How do I call it? Remarkatron or Remarkatron? Remarkatron or Remarkatron? Welcome. Remarkatron or Remarkatron. Where does that name come from? How did you get into that name? Remarkatron. How did you end up having this name? Remarkatron. Greetings everyone. Greetings. How did you end up getting that name? Is it something? Remarkatron. Felix, well,
look at this. Very good quality
Felix,
of
thank
kidney.
you, but we have
Thank
another
you very
bar.
much.
We have one more bar. Thank you. Thank you, Felix. Thank you. Thank you. Thank you so much. My meds bill there is 2 bars. Thank you. Make sure you get something nice for yourself, okay? Make sure you get something nice for yourself, okay? This is a random name. You don't have to worry about my name. I just use the name when I make a noisy post. It's a random name. I'm not worried about your name. I'm curious. I'm curious because I do see some people having names that I've never heard before. Like Ronbis. It's actually Robin. Ronvi's hat is actually Robin. You know? Oh, one question. How old are you? I'm ready to everyone's age. I hope they saw something nice for me. I'm crying. Like, send me the surgery. I was so optimistic about not getting the surgery done, but every day it gets even more painful. So I'm like, I wanna cry. Every time I go out, I just want to vomit. And yeah. Well, isn't it good for the channel? What is good for the channel? Can you see my tonsils? Come put me down. They're all solid ground. You know what? With my ears punctured, I don't know if I can sing anytime. I don't know how someone who doesn't know you at all find you entertaining. I do like being around you because I've loved you for the longest time, but that's different. That's very sweet. Thank you. I just used one earphone. Okay. New people who has never heard me sing before. Did you know that I'm actually a singer? And then I got beheaded. AKA I got a thyroid surgery. I got a thyroid cancer surgery, so I can't sing. Where is this sound coming from? The heck? Oh, okay. At this point, with how bad it is, with short-term and long-term comfort, Beethoven was deaf. Stop! I don't want to be deaf! Pause! You're not helping! You're not helping! That's all she is. Not only cute, but she plays amazing singing. P, I have a question though that I have been wanting to ask for a long time. Maybe not on stream. I don't know how open you are. Yeah, maybe not on stream. Never mind. Oh, microphone has to go this. Yeah, I wanted to ask something, but I'm like, no. I'm not sure how open P is. No, not to P. No, that's not the question. Alright, let's go. You can't pin me down. Wait. Okay, thyroid is still not letting me sing well. To bring it down. It's okay. I'll just sing a tiny bit. Because I don't know after the surgery if I can sing or not. You can't pin me down.
I fear all solid ground. I'd rather be alone at tea, laugh when nobody's making me. Oh, boys just make me cry. Believe me, I tried. I've made my rounds, kissed some mouths. Trust me, I don't want a single soul around. No, I'm giving up, I'm throwing in my hat. I can take another lifeless little chat. I'm moving up into a cloud, into my fantasy. And no boy's gonna be so smart as to try and pierce my porcelain heart. No boy's gonna kill the dreamer in me. Alright. That's it. Cause I don't know, once they make a hole into my eardrums, can I still sing? You know, I don't know. Ooh, the picture's a go. Thank you. Oh, that's it. Yeah, I can't sing more than that. Fantastic, wonderful times, thank you. Oh, my neck hurts. That's my fault. Yeah, I don't know. Once they make... Oh, let me see actually. I still do. Yeah. Oh, that hurts. Oh, singing triggered phlegm from my GERD. I don't know how I found you again. Was fate? Where are you looking for me? I've always been here. Never been anywhere. I hope that at least at the end of the year I can sing, you know? It's been, I don't know, it's been 2.5 months, almost 3 months since my surgery. What do you call again? Me. Meritogamy for singers. For singers, a meritogamy rely heavily on exact pitch, head resonance, acoustic as the procedure requires careful. Oh, I need to tell him I'm a singer. Oh, autophony. Okay, I need to tell. I am a singer. Okay, wait. I need to tell the doctor that I'm a singer. Yeah. Any question before I end the stream? I've yet to know if it's Sunday. I don't know when I'm gonna stream next week. Maybe on Friday or Wednesday.
Maybe Wednesday I can if I feel okay. If I feel okay. Write a memo already. Already, don't worry. I have my ways. You know, okay, I have ADHD, right? Which was diagnosed later in life. I have my own system to remember things. But what I don't like is, people making it as an excuse. Oh, I'm got ADHD. I got bipolar. I got depression. I got ADHD. All of those stuff. You can't just make that as an excuse. It is one of the reasons, but you can't always rely on. You can't rely on that. Okay, I'm mumbling. Yeah. Yeah, so yeah, I will let you know again by next week, because I'm gonna meet my doctor next week and see excuse me, and see how he feels about this. Yeah, very soon. Thank you. Yeah. Yeah, thank you very much. Yeah, I'm gonna talk about, I normally talk about 30 stuff, people in 30s, 40s. Hi everybody, thank you for coming. I appreciate it. I love you so much. I love you so much. Give it a thank you. Yeah, I think because the other the other things are already appearing, other discomfort and everything, tinnitus, although it's deafening. The other things are are taking away my attention. And I want to say, okay, I've never said this too much, because I'm afraid talking about monetary support, just because I do say it in membership, but I'm afraid of saying it online, as in live, because I get anxiety that maybe people would think, stuff. But honestly, thank you so much for helping me. This is my full-time job, and after Karaoke disappeared, it became very difficult. But the most difficult part is that I have medical problems. And my medical problems are the reason why I can't do karaoke streams. But I need to thank you so much. Thank you so much. I know I always say time.
Welcome.
Own Sonata. Thank you for the gifts. Oh, Hiryu, you got it. Thank you. Owen Sonata. Thank you, Owen. Thank you. Her gift. Yeah. Thank you so much from my heart for making me comfortable, because imagine if I have to go insurance route with this kind of problem, it's gonna be long, it's gonna be painful, but because of your help, I can do it anytime the doctor's ready. I can do it, because I have the means, I have the money. Back then, I had this one psychiatric meds that I could not afford. It was supposed to be 400 milligram. I could not afford it, so I bought what I could afford, which was 100 milligram. So I know that feeling. But now, this discomfort, although it's so unnecessary, but you guys are so kind to me. To the point that I can just get any surgery anytime I want. This surgery anytime I want. Yeah, thank you for the monetary support. Really. Thank you. This is my full-time job. Thank you. Yeah. But if you can't support me monetarily, please don't worry. Your worth is not any less or any superior, than those who support me. Because at the end of the day, like I always say, time is your most expensive currency. 24 hours a day. If you don't know how to help me, but still want to help, please go to my shorts. On your desktop, go to my shorts. Play like 10 or 12 of them, I don't know, 20 of them. Loop it for 30 minutes. or 3 times. Yeah. And then click like button and leave a comment. If you don't know how to help me by engaging with the stream. And with the stream, hit the thumbs up and like and then leave a comment. If you don't know what to do, how to help me, that's gonna help me a lot. Efek pertama kali ngidol seumur hidup. What is ngidol? That's what I tried. Yeah, thank you. Zoey, I'm sending you all the best wishes. Thank you. If you want to send me the best wishes, please like the stream, leave a comment to it, and loop my shorts 3 times. Leave a comment to it and a thumbs up. That's how you can support me. Okay? Ngidolain orang. Wait, efek pertama kali ngidolain. I don't understand. Like admiring someone. So who? Me admiring you or you admiring me? Zoey admiring you or you admiring me? Yes, if you want to know about the shorts. Yeah, go to shorts. Tag Zen. What to do? Thank you, Zen. Thank you. You're the best. Or acknowledge someone as your idol. She'll do as role model. Oh, regarding the shorts, you can always you can always go to my Discord server now. Zen. Yeah, thank you. Zen's my volunteer. Yeah. I have a few volunteers here. We have Zen. We have Clock. We have Gribo. We have Gorong. We have Marioneta. We have we used to have Demon. Where is we have we have Araeshiki. Grateful and Marioneta. You guys are the only mod. Wow. Yeah. And then I have my staff team, paid staff team, my manager, and assistant is Josephine Clock. Yeah, I already said those names. Josephine, and we have not Jojo. Jojo. My mods team are based on Little Women. So we have Joe, we have Beth, and we have Meg. They are all from Little Women named Jojo MVP. Yeah, so much people. Yeah, they help me a lot with timestamps, with archiving, with Reddit posts, with recordings, with I think we have 3 mods on the furry pit, and I'm not even the owner. I left it to Gribo because I know if I am the owner of that, I'm gonna burn the whole server. Yeah. So nice to meet you guys. If you haven't met my staff team, how did me and Jojo met? Jojo wanted to call her name Amy because Amy from Little Women. I'm like, Amy is too close to Emmy. Emmy. Someone called Emmy. Dan. Emmy. Ko. Emmy. Ko. I just drag her bomb here. I'm like, Jojo, work with me. Jojo, you wanna work with me? You wanna work with me? Yeah. Okay. Let's do this, Jojo. We can't do this, Jojo. Okay. Good night, everybody. I love you so much, and thank you so much. You're such a wonderful community. I'm very strict with my community. If you piss me off and you make others uncomfortable, I will ban you right away. Yeah, Emmy sounds very familiar somehow. Thank you for listening to my. I need to stop talking. Good night. Mwah, mwah, mwah. Good night. I love you.